there, my name is Erin Wilkins. I'm with the Beyond the Pill Project, and I'm here today to talk to you about IUDs and implants and incorporating them into your contraceptive counseling. So I'm going to start today by talking about some bleeding changes that can happen with use of LARCs. So bleeding changes are one of the primary concerns that our patients come to us with as they're considering starting on a LARC method. A lot of times people are wondering how LARC methods are going to impact their menstrual cycles and really how they're going to impact their daily lives. I think that incorporating information about bleeding changes is really important because it gives patients a realistic expectation about what they can expect, what's going to happen to their body, and I think ultimately it can help people stick to the methods that they've chosen because they know what to expect. So some of the stuff we're going to cover today, we're going to talk about common bleeding changes and patterns that people can experience. We're going to talk about some of the cultural considerations to take into account as we're counseling patients. And then we're also going to talk a little bit about effectively applying our own personal assumptions about bleeding into our interactions with patients. All right, so cultural considerations and bleeding changes. So we know that our patients and our clients are really concerned about bleeding patterns and menstrual cycles. A lot of us, I think, can really relate to that. I know I can. Bleeding changes mean different things to different people. So I think it's so important in situations where we're counseling patients about LARC methods or any birth control method to really consider whether or not we're bringing our own personal assumptions into the room. We want to ask questions to our patients about what they would like to know. What do they value around bleeding? What are their concerns around bleeding? It's so important to ask patients those questions. An example would be, rather than saying, wouldn't it be great to not have a period? That kind of assumes that the patient would think it's a positive thing to not have a period. For some of us, that might be a great thing. For others of us, that's not a great thing. So another way we could rephrase that is to say, what would it be like for you to not get a period? What would that feel like? How would that feel? So trying to come from a curious perspective rather than just assuming we know how they're going to feel about bleeding changes. So what are some of the reasons that a person might want to get a period? I mean, there's a lot of reasons out there. Can you imagine what some of those reasons might be? Okay, yep, reassurance that they're not pregnant. That's a huge reason to want to get a period. Every time a person gets their period, they feel some reassurance that they're not pregnant. That's a good thing. What else might a person be concerned about and want to be getting a period? Okay, worried that not having a period is bad for their health. I think that's a really common concern. People wonder if it's unhealthy to not have a period. I think there's some misconceptions that your period is kind of just building up inside your body and that can be unhealthy. So that's definitely another reason people would want to have a regular period. Anything else? Okay, definitely a good one. Parents and partners kind of checking in or keeping track of a person's period. There's a lot of different reasons that might happen, and that can be a really important reason that a person would want to be getting a regular period. So yeah, bleeding changes mean different things to different people. And menstruation and bleeding changes can really impact a person's participation in a lot of parts of their life, in religious activities, in sex, social activities, and just everyday life, really. So we want to avoid making assumptions, we want to ask questions, and we want to keep it client-centered. So with LARCs, what bleeding changes happen? We know that bleeding changes happen pretty much across the board. IUDs and implants, people are going to experience some bleeding changes. So with Paragard IUD, people often notice a heavier, longer cycle, heavier bleeding, longer bleeding, and that usually can happen for the first 6 months. After that time, we see that it stabilizes, usually to around 4 days a month. For the IUDs with hormones, we often see irregular bleeding and spotting for about the first 6 months, similar to the Paragard IUD, around 6 months for it to kind of stabilize. And then usually most users will have decreased bleeding within 3 months. And many users find that within a year, they're not having a period at all. Nexplanon, it's really common to have unpredictable bleeding and spotting, overall lighter bleeding, and around 20% of folks are gonna stop having a period altogether.